KTVU Fox 2 News, this is The Four.
Take care.
Troubling news out of China. The new study that's raising questions about the accuracy of COVID-19 testing. We're going to talk with a Bay Area infectious disease expert next. New research from China shows that the most common coronavirus test gave false negative results about 30% of the time, meaning a person who was told they didn't have it when they actually did. Researchers say one issue is swab testing, which can be administered incorrectly. There is also a question of the time period for when an infected person would test positive. So let's talk more about this afternoon with Dr. Gregg Tolliver. He is an infectious disease specialist there at MarinHealth. And Doctor, I want to first ask you, what does this study, what does this suggest about the accuracy of the COVID-19 testing?
Well, it's been a problem that we've been trying to address at hospitals and clinics because we have concerns about that, certainly, because there's lots of ramifications. We want to really know if someone has it and if they're infectious or not, because there's major safety issues for everyone involved there. So, for example, at MarinHealth, we've recently been trying to roll out education for providers who are going to be taking the sample. It's not easy to do. It's not a very pleasant experience for people who are getting the sampling done. So we've been doing some swabbing with 2 swabs, one in the oropharynx, back of the mouth, and one in the nose, and trying to follow the most efficient protocol for sampling. And we think that that's going to really improve the sensitivity of the test.
Explain a little bit more about why a false negative result might actually occur.
Yeah, well, you can imagine being a frontline personnel. They're actually doing a really good job now of sampling, but you've got to stick a piece of plastic all the way back into someone's nose, and so you're worried that they've got a really serious infectious disease. So you're kind of maybe a little hesitant to get close to them to do the job. You have to put it all the way back into the nose. It's uncomfortable for the patient, and you've got to twirl it around for at least 10 seconds to obtain an optimal sample. So if that's not obtained, and you submit the test, then there's a chance for a false negative test.
I want to talk about positive results. What does this study suggest about positive results that are coming back for folks? Is there any question about the accuracy of those results?
Well, I think that if you're positive, you certainly have had it, the SARS-CoV-2 or COVID-19 clinical disease. If you're positive, you've had it fairly recently. So the question is whether or not those positive tests reflect the particular sensitivity of the test. Where are we picking up just little bits of the virus and it's actually dead, or are we picking up live virus? And that means that if it was live virus, that the person's still probably infectious. So that remains to be determined.
And before I let you go, it sounds as though you there at MarinHealth have made some adjustments to how you're testing folks.
Yeah, well, it's every day there's things that need to be adjusted so we can optimize patient care and provider safety and efficiency. And every healthcare institution is dealing with this right now. So we've been looking for guidance from the state and from CDC and from our partners at UCSF and from Marin Public Health. They've all been excellent at helping us.
Yeah, I guess everyone's sort of adjusting as needed. Dr. Tolliver, thank you so much. Really appreciate your insight today.
My pleasure.